Good afternoon. Welcome to my home here in Riverside. I can't remember when I've had so many people stop by to visit. While you are here, I would like to tell you a little bit about myself. My parents, Felix and Nora McCarthy, were born, raised, and married in Ireland, but they wanted something more for themselves and their children, so my father emigrated to Boston and worked his way to Plymouth from there. He found a job in a sawmill and sent for my mother. He eventually joined the police department, where he worked for nearly 40 years, working his way up to being police chief. They had 4 sons before I was born in July of 1899. Because I was the only girl, I was treated as special, and I grew up in a home filled with love and the lilt of Irish laughter. I graduated from high school in 1918. My brothers were caught up in World War I. I wanted to do my part, and nursing interested me. Dr. Bell from Lincoln had started a small hospital and nurses training center on Highland Street, and I enrolled there. It was soon sold, and because the Emily Bald's Hospital and the nursing program was discontinued, I talked my parents into allowing me to go to Manchester to train at Sacred Heart Hospital. I was there for 3 years. I attended school for 12 months of the year. My father had to sell a pig or a cow occasionally to pay my tuition and keep me afloat. When I graduated in 1922, I returned to Plymouth to work in the Emily Balch and Soldiers and Sailors Hospital, which had opened in 1920. It was a state-of-the-art hospital at the time. While I was there, I met Eddie Parent, a young man my age who worked as a brakeman for the Beebe River Railroad. He had managed to break both of his legs, and he was treated at the hospital. And he was so nice to come back and say thank you to the doctors and nurses for caring for him, and he was pretty handsome. So we discovered we both owned a Ford, and mine did need some repairs. So Eddie offered to take me to his mechanic in Holderness, and one thing after another, on January 4th of 1926, we were married, and we moved to Lincoln, where we thought opportunities might be better. Eddie found a job in a locomotive repair shop, and I did some substitute nursing until our children Carol and Bruce were born. Lincoln was a small logging company town, but it had energy, and we liked it. By 1930, the population in Lincoln was about 1,548. But in 1933, the Parker Young Company declared bankruptcy, and in 1935, the high school burned in a terrible fire. 1936, a lot of wonderful things happened. My daughter Carol was born. The new high school was built. The Parker Young Company sold 70,000 acres in the East Branch watershed to the U.S. Forest Service. And today, that is a beautiful part of the White Mountain National Forest. But back then, the logging operations had denuded almost the entire forest cover. By 1948, my children were becoming more self-sufficient, and I missed nursing, so I took the job of public health nurse and made $1,100 a year. Most people called me the town nurse. The job description of a town nurse was somewhat fluid, and execution of duties depended largely on skill level, initiative, and personality of the person filling the role. It has been described as the evolution of a nurse in a small community, from volunteer service to her neighbors to a paid position, which eventually included reimbursement from Medicare, much like today's visiting nurses. The town nurse, back when I was doing it, provided nursing care in the community, emergency preparedness, communicable disease prevention, and home visiting. But depending on the person doing the job, it could be, and usually was, much more. The job addressed health needs across the entire lifespan of my patients. My job included primary care, sick visits, triage, and community-focused care such as immunization clinics. I was responsible for identifying and meeting the health needs of an entire kaleidoscope of people through collaboration with others in the community. I needed to be a point person, working with as many different community groups and as necessary to meet the individual needs of my clients. I was charged with overseeing and arranging for school physicals, which included checking everything from posture, vision, teeth. I worked to provide x-ray clinics because of the great fear of tuberculosis. I knew children who are hungry cannot learn, so I worked to try and provide a hot lunch program. I made visits to pregnant women to suggest healthy diets and prenatal care. I also visit new mothers to check on their babies and, if necessary, help them learn how to care for their infants. I visited children crippled by polio, and I did field visits to sick members of the community, and if necessary, tried to make sure they could see a doctor or reassured them if a doctor wasn't necessary. I visited with the aged and infirm and the lonely to check on them, and often just to listen and ease the loneliness. I held the hands of those dying alone and helped them with accidents at mills, and visited wives with bruises and broken bones from abusive husbands. In my spare time, I worked on a fund drive to raise money for medical equipment and oversaw Christmas baskets for the needy. By 1952, my salary had risen to $1,750 a year, and I held two distinct parts. I was the school nurse and the public health nurse. I had to file 2 reports for the annual Lincoln Town Report. There were a lot of exciting things in my life, but in 1953, in March, I took a few days off and went on a trip with a few of my friends to Washington, D.C., and we went to the home of our own Rachel and Sherman Adams, who were living there because Mr. Adams was chief of staff for President Eisenhower. Miss Adams took us to the White House one afternoon, and we had tea with the First Lady. You will remember that Mr. Adams also spent time in the U.S. House of Representatives, and he was 2-term governor of New Hampshire, and he is the reason why we have skiing at Loon Mountain today. He and Rachel are my neighbors here at Riverside. The following year, in 1954, I was able to add clinics for vaccinations against diphtheria, tetanus, and whooping cough, and physicals for all children entering school. We had no local dentist, and of the 281 children in local schools, 111 had defective teeth. But excitement was high around then because in 1955, President Eisenhower visited and gave a speech at the high school for the 150th anniversary of the Old Man of the Mountain. And in Lincoln, the President of the United States, could you imagine that happening? One of the most satisfying moments of my career was in 1956 when we were able to start polio vaccine clinics, and 449 individuals received the 2-dose inoculation. Polio was a dreaded crippler of children in particular, and this was a marvelous advance for which we can thank Dr. Jonas Salk. At that year, I also made 150 visits to schools, prenatal visits, and 98 infant checks, 400 non-communicable disease visits, 773 home visits in Lincoln, and 593 in North Woodstock, and I still worked on Christmas baskets for the needy. As the town grew, the job description changed. I became community nurse in 1958 as I was visiting folks in both Lincoln and North Woodstock. I was also doing more social service calls, working on blood drives, doing dental clinics when I could round up a dentist, helping students with poor vision and little money to obtain glasses, doing tuberculin patch tests and x-ray clinics whenever possible, and doing demonstrations for the Girl Scouts and women in the community on everything from care of the sick at home and bathing newborns to first aid. By 1960, the logging area was finally finished. In 1962, I was officially covering both Lincoln and North Woodstock. In 1966, exciting things going on, it became necessary to form a health association in order to provide services for those coming under the new Medicare regulations. While Lincoln and North Woodstock were still caring for their own, the federal government was putting in place a medical safety net. I was named director of the association. The following year, we changed the name of the association from the Lincoln Public Health Nursing Association to the Linwood Home Health Agency to better reflect the community being served. At that time, also, the paper mill was on its last legs, and thanks to Mr. Adams, Loon Mountain was helping to begin the transformation of the town from its dependence on the mills to the four-season resort area it is today. By 1969, I felt it was time to retire. In addition to my work for the community, I had also served as a member of the board of directors of the New Hampshire State Nurses Association in District 5, held membership in the National Organization of Public Health Nursing, and was a member of the National Delegation of Republican Women. One of the most special highlights of my life, right up there with you with the First Lady, happened on November 13th of 1969 when all of my friends in Lincoln honored me with a testimonial for my many years of service to the community. The event took place at Loon Mountain, and our Mr. Sherman Adams was the master of ceremonies. It was a wonderful way to end my career. In 1975, my daughter Carol came home from her own nursing career in the Boston area to help care for my husband and I have to admit we were slowing down a bit and were grateful for the help. Incidentally, that was the same year Burndy came to Lincoln, and the Highland Games began as a Klan picnic at Loon. In 1977, I moved into my home here at Riverside. If you take one thing away from our visit today, I hope it is this. Enormous strides have been made in medicine since I retired in 1969, and I wouldn't want it any other way. But maybe we have lost something. The town nurse was a uniquely New England answer to rural nursing in a time when there was no governmental safety net, and people looked out for their neighbors and towns cared for their own. The town nurse often knew more about the lives of her patients than anyone else. Part friend, part priest, part skilled medical professional, part comforter-in-chief. It was most often the town nurse calling day after day on the sick, the old, and the needy who was on the front lines. What she knew, she kept to herself, and that engendered trust. The numbers in the town reports cannot denote the value and comfort of residents when a nurse comes to someone's home to treat them, or when someone just needs a caring person to listen and talk with. That connection was real, valid, and comforting, and is largely missing today when a doctor is allotted only 15 minutes per patient and has to consult his computer to check your past history. And you only know your nurse's name if she is wearing a name tag. I'm not saying the old way was better, but perhaps it was a touch warmer and more personal. And I think we need that today, just as much as we did back then. Thank you all for coming and listening so quietly to a lady natter on about her life, and bless all of you.